and welcome to the webinar. This webinar is designed to assist you to work through the clinical audit for your diabetic patients. My name is Sharon Ashman and I'm here to help, so we'll slowly go through this with you. If you could open your MD or medical director at this page. This is my summary page that I usually open my patients in, and it contains all of the patient information in a snapshot. So you can see here there's very little family history and social history. We've got past medical history, their medications that the patient's on, and their immunisations, as well as any sort of preventative health. And you can see that there hasn't been a physical assessment that's been completed in the last 12 months. I'm using obviously a made-up patient, and her name is Heather Andrews. And today we're just going to be going through her diabetic information rather than anything else. So first of all, what I'll get you to do is go into the top bar area here, and you can see there's a few pull-down menus: patient edit, summaries, tools. Click on the clinical one, and you'll see it will drop down into a diabetic record. Click on the diabetic record. Now this will contain all of the information that is relevant to your diabetic management. It will also assist you in completing your diabetic cycle of care because it will highlight areas of need or areas that need to be investigated. So if we look at the first page here, you can see that I've already done a test assessment to make sure this webinar actually works. And you can see here that the individual has seen an ophthalmologist or an optometrist on the 30th of the 1st, 2018, been a podiatrist on the 19th of the 12th, 2017. So, and that they haven't actually had a hypo kit, but they may not require that because they may not be on insulin. And they've seen a diabetic educator on the 12th of the 12th. So already you get a snapshot of where your diabetic patient is being cared for and where the gaps may be. You can see here in this panel the major parameters, the dates, obviously, and the blood glucose, which by the looks of it's never been measured, the height, the weight, the HbA1c and when that was last done, your creatinine, and we know that creatinine and albumin ratio help to identify any chronic kidney diseases from stage 1 to 5, so they're probably important to include and can be done via a urine test, which you test for microalbuminemia. You could just add an ACR into that. BP or your blood pressures, your cholesterol, triglycerides, HDLs, and so on. Now, these are all the parameters we know that are required within the RACGP guidelines to be measured for a diabetic patient. The timing is determined by the individual situation of the patient. But for your diabetic cycle of care, they've all got minimum amounts that they need to have throughout the year. And that will be on your MBS Online. So if we go on to the next level, we see the follow-up here. If we press assessment, what will happen now is you've actually started the assessment. So it'll have the date, the type of diabetic, which is important to identify for particular reasons. And you can see here there's quite a number that you can identify. There's the type of medication, and this is basically not in names, it's in the type of medication. So we can say that, are they on insulin, or are they on metformin? In this case, this individual, as we can see down here, it's only on the metformin only. So we're just going to click on that one. Sorry, metformin only. When was she diagnosed? The year 2000. Is she currently a smoker? Absolutely. And how many a day does she smoke? Well, again, we can change that if it changes as you're going along, or you've been having a bit of a chat with her and her smoking's actually gone down now, so she's only on 8 a day. She drinks alcohol. She drinks really moderately. She drinks about 6 a week. We say that she has adequate exercise because we've done an assessment, but we haven't actually done a physical assessment through medical director. We've just done that verbally, and she meets about 150 minutes a week. Then you've got, has she seen a dietitian? Well, not quite yet. Seen a diabetic educator, as we can see, and you can pull these menus down and change the dates if you want to. You can go back or you can go forward. Obviously, you can't go futuristic. So say she's seen one again then. Has the patient seen an endocrinologist? The EPC is the health assessment and the healthcare plan. So this is your reviews, and this can be seen as your actual initial plan. So in this case, I've set up my sample, and that she's done her original care plan on the 12th of the 2nd. Let's take that back a few months so we can make this more look like more of a review. So let's say that she's done it around about, you know, let's take it at the end of October. Done it around the end of October. She's now come in for a review, so we're going to put today's date in, which is 27th. This is a conference, and some practices actually get all their diabetics together, and the practice nurse will speak to them regarding their chronic disease and better management, or they might get an exercise physiologist in. So you can put in that if you do that at your practice. Then the history is the last 12 months, and this is to identify any of those risk factors that might be occurring due to diabetes. So have they had a stroke or an MI? Has there been any amputations? You know, how's their kidney function going? Are they at the end stage where they're needing dialysis? Any severe hypos requiring assistance, so that might mean hospitalizations. And how's their eyesight going? Are they now getting worse, or they've actually got a new blindness in one or two eyes? So the next area, this will self-populate the weight, height, the waist, BP. These will all self-populate if you put them in the observations before you do this clinical audit. So it might be the patient comes in, let's weigh and measure them, let's check the pathology tests are here, let's get all that in the computer and make sure it's correct before we do this audit. We now know that the waist is part of that accreditation and needs to be measured on a regular basis, but at least once every 12 months. This is your observation. So when you're looking at the patient, you're going through their general physical observations. You know, have they got swelling of the legs, got a bit of edema? Can they feel their legs really well? They're actually reporting some peripheral neuropathy, that their hands or forearms aren't feeling the best, and they're feeling that they're feeling on the back of their hands or something like that. Their varicose veins have got worse or whatever. So you can click them or you can click them off depending on what the patient's showing. So this is your observations. Go on to the next one, and we can see here I've already put in that her site is 6/6. Well, let's have a look at 6/9 and 6/12. So this person's on the borderline there. Have they been to an ophthalmologist or an optometrist? Do they need some checking there? They need their glasses amended. Has their patient visual acuity deteriorated in the last 12 months? Well, I'm saying yes to the left-hand side. We've got a report back from their optometrist or the ophthalmologist, which we know is a challenge in some practices, and it might be a matter of giving the patient a note to give to their optometrist to say, hey, please send your report back to us. You get that report or evidence of that report, and you put in when they saw that. You don't necessarily need to fill in the result because you'll have that in the file, but sometimes it's just good best practice to do that. So you can put in that they're actually fine, they've got no retinopathy, or there is a bit of abnormality, but it's actually not due to diabetes. It's actually due to, you know, an astigma or something like that. There's nothing to do with their diabetic condition. This one here is their foot care. It gives you an idea of a snapshot when you quickly look at it. Have they had an ulcer? Do they have a current ulcer? Is there any foot deformity? And is there any lesions other than ulcers? Because they can still have, you know, dried skin that's turned into a sore rather than an actual ulcer. And then you go, okay, when did I do the foot exam? Well, you know, I've done the foot exam on the 27th, and I previously did it when they came to see me just before Christmas. So there's my 2 for the year. That's done. Yay. So now we go on to the next one. As you can see, it's just clicking through. It's very self-explanatory. This area, the investigations, should self-populate. When you upload your pathology results, this area should be filled. If for some reason it's not, you can go into view, and in this case I've added this in because this was a make-believe patient, but what will come up will be your investigation, your results. This time is the HbA1c at 53, which we know is around that 7, so that's not too bad. But there might be other tests there, you know, EGFR, you know, full blood counts, whatever, that all could be there. But these results should self populate. If not, you will have to go into the view and add them in individually, and then look at what's going on with your medical director and see what the glitch happens to be. And you can set a target of where you want that individual to be and discuss it with senior clinician. This is your medication area, and this individual on metformin. Do I want to do a medication review at the time? I probably wouldn't do it during this audit because it takes a bit of a time and the patient's in front of you. But what I could do is flag it in that, once a year, this patient's already on 5 medications, they've got reducing kidney function, all of those eligibilities for what we call a DMMR, or a home medication review, or a 900. I might just flag it and put in a request from a pharmacist to do a home medication review, and then leave that up to them to get back to us and follow up and then claim a 900. That's entirely up to how your practice works, but certainly good practice or best practice to review a diabetic's medication at least once a year. I save that now, and as you can see, what will happen is the assessment will save. It didn't save an extra one because I'd done it in one earlier as a test. But one of the benefits of being in here is you can see at a snapshot where the patient might be missing. This patient definitely needs an ACR, an eGFR, and a microalbuminemia. The other thing is, once I've got a few results in there, what I can do is I can go, okay, here's some graphs. Here's the fasting blood. Obviously, that hasn't been taken for a while. HbA1c. What's happening there? Is it going up or going down? My HDL's going up or going down? Total cholesterol, how is that going? You can get a little graph. You can do a little snippet from this, drop it into Word, and print it off for the patient so they can actually see what's happening. I find this a good tool just to give to the patients if they're, not being as well managed as they possibly should be. And then once you close it, what will happen now is you go into your progress notes. It'll be in your progress notes as diabetic assessment performed. And then you can get on with your consultation. What that means, though, is when you start to do your diabetic audit and you go to your front page of MD, is you look in here and you go to clinical and you go down to diabetic records, what you'll see here, oh, hang on, what's happening there? Close that. Go into clinical, search, diabetic register. I gave you misinformation, sorry. These are all my diabetics. This is what they've had. This is their last visit, when they had their eye exam, foot exam, height, weight, BMI. I can see where my missing records are here and here, and who I need to maybe call up for a review. The other thing you can do is you can look at your stats. So how well are you travelling as far as measuring your diabetics within your practice? And as usual, MD is a bit slow, so I apologise for that. You can see here, I'll just increase that for you because it's on the screen, that, out of all of your patients that are registered as diabetic within your practice, you have got 60% of those meet the criteria for having the HbA1c done in 12 months. You've got all of those have had their eye examinations done in the last 2 years. You've got 100% of those had the height and weight done. 80% have had their smoking, and so on. So you can actually see how well you're managing your diabetic patients. And this can be a little bit of a project for you as far as continuous improvement. So I'll just close that for you. So I hope that's assisted you. My name is Sharon Ashman, and if you wish to speak with me, please feel free to call the Mackay PHN and ask for Sharon Ashman. Thank you very much for your time.